So, I want to welcome to our newest episode of Blether with Barberra, our special guest today, and this is Alexey Dmitriyev. Alexey is joining us all the way from New York, and so thank you and for giving us your time. Alexey, what I'd obviously just like to do initially is give you the opportunity to just explain a little bit about you. It's almost just a snippet of a bio about where you're at, what your intentions are regarding health and well-being for humans, and what you're hoping to achieve first and foremost.
So my name is Alexey Dmitriyev. I'm in New York City. I'm a social worker. Been a social worker for 15 years, primarily working in medical field with health insurances, with people, seniors and disabled. And one of the areas that I found since COVID is that people um, there's a trust there's a trust was broken between the healthcare and individuals. I think initially when COVID came out, it was really people come together, supporting each other, meaning nurses, doctors, and each other because there was just a new thing that came out and scary thing. And then once vaccine got rolled out, all of a sudden the trust become broken because people felt like they were pressured to take vaccines, which felt like some individuals felt like this was not something that they would like to do. And then some individuals became injured. So during that period of time, I felt that there was just not enough the trust kind of conversations. We couldn't have a conversation openly. If I don't take vaccine, I'm betraying my family member, my elderly, I'm putting them at risk. If I took vaccine and all of a sudden there's a new changes happens within my health, I could not speak to that because it couldn't happen since we went through rigorous process of testing and therefore were safe to take it. And so that's where I came in between because I felt that now the person needs to be heard and receive support because that's one thing. We need to be able to one part that we do well is when we are being seen, being heard, and being supported. Those three qualities that we do, right? And when we don't have one or another, then everything else falls apart. So part of it with I started a company called Guide to Care was to allow people to be feel seen, heard, and supported. That's three basic needs that we all want and need.
Sure.
And the other part of it is to provide relief, right? Because one of the areas that we found ourselves is sometimes in the healthcare, we find ourselves get built too many tasks happens. So the issue becomes this. Let's say you go to primary care physician, right? You need a new referral. You get the referral to specialist. The doctor sends this request to insurance company and then tells you, here's a referral. Then you take the referral and you find a specialist that takes your insurance. Then you go to actual specialist. Specialist says, okay, they see you. And then they send back notes or don't send back notes to your primary care physician. And so you're stuck. So you now have to make sure, so you're coordinating all those tasks. And overwhelming, especially if you have a new condition, right?
Yeah.
But that's where I came in, and part of advocacy, part of being patient advocate, is to help people to take some of that off their plate, some of those tasks off their plate. They could focus on one thing: is getting healthy.
Yes, that is so resonates so much for us here because we are obviously at the moment in the run up to a general election in the next couple of years, and NHS is our healthcare system and social care system as well included in that is always a political football, and one of those things is privatizing the NHS and creating the private healthcare exactly like America. And we always, those who don't want the privatization of probably one of the best healthcare systems in the world, free at the point of access, is because of what you've just said about the having to go here and get the insurance to agree it, and then the insurance, and you got to find the person that takes the insurance payment. And it just is it can get very messy for some people. And it's great that you're sort of the advocate and you'll come in between and do that. But a lot of people don't have access to that. And America's a much bigger country than we are. And it's nice to hear, obviously, that we're not the only country that's sort of struggling with the way that healthcare is provided, almost like it's money is the first thing that they think about. So how can we do this to make this profitable for us, rather than what we have at the moment? The NHS it's slowly sliding towards that profitable thing, but it's always been since I was a child. Health comes before pounds, people before profits, and now we're starting to see a slide of how, well, we need to make this profitable. And when you're dealing with humans, we shouldn't be allowed to put a price tag on a human's health, but it's happening. And we're trying our best to keep away from that, just because we know it's going to be a struggle for people. And there will be people that will fall through the cracks. And I don't think there'll just be one or two. I think there'll be thousands, if not tens of thousands of people that will struggle. I won't go into the COVID thing, but I will add on. I never had a COVID vaccine because thankfully I worked in medicine. So I didn't do the care role I do now. So I wasn't forced to because of the requirements. The early days I worked with doctors in my old role. So I sat next to doctors and in conversations with doctors in relation to vaccine, because I got prostate cancer. I was heavily advised not to take the vaccine because it would have affected my cancer and made it worse. But I get why people mistrusted, because obviously my background in medical law, the complaints ramped up against healthcare since 2020. Claims against the NHS have ramped up. And just the attitude through members of the public and the media towards the NHS. I mean, a little bit of it's political manipulation to sort of get this privatisation through the back door. But a lot of it is that, as you said, there's a lot of mistrust about the rollout, the speed of it, and all of the COVID thing and the lockdowns and people being restricted from seeing people that were dying, family members. So I get that, but that would be another podcast to talk about in a long time, because that could go on for hours. And I would do that. I'm not afraid now, because I couldn't talk about it when I worked in my old role because of obvious reasons, because of working in medical law. So I just want to, you've described greatly there, and I've seen obviously on your LinkedIn profile, your work in terms of building support networks that bring humanity back into health systems. So what does support network mean to you, and why is it so central to well-being in the United States today?
I think we need to slow down. So right now, medical doctors, you go to a medical appointment, you see triage, you're being triaged, right? Before you see the doctor, you see it as a nurse. I mean, the front desk first, find out why you're there. And then you go to the room, the nurse triage you. And then you see the doctor. And doctor spends, the whole process could take about an hour. But the doctor, you and the doctor only did maybe 10, 15 minutes maximum, because they have a bunch of clients and patients. So sometimes they see 30 patients a day, sometimes more depending on the clinic and doctor's appointments, right? But the thing is, part of what happens is that how can you answer the questions that you're looking for? If you struggle with something, if you're not taking medications. So part of support means is that, how do I get most out of the appointment, right? It's what questions should I ask? What my worries are. So it starts with me, right? With you first. So kind of a conversation starts with, before appointment happens, hey, what do you want to get out of appointment? What do you think purpose is for yourself? What do you want to get out of the appointment, right? What questions you might have, and what changes happens within your health. And then you write them down, and what questions you would like to answer, right? For the doctor, if you have experienced side effects from medications, right? Or is there something else you're not sure what's happening, or you maybe not able to afford the medication, so you want to bring the patient to the doctor. And so we kind of develop a plan, right, with you, kind of saying, okay, so let's start here. What do you want to get out of it? Why are you going in the first place, right? So what do you know about that? Then what do you want to get out of the appointment? What fears you have, what changes you would like to report back. And then you develop a plan, you bring that plan with you. And when the nurse comes in to do triage, basic, your weight, your height, you give that list to the nurse. So when the doctor comes back, they already know what you're looking for. So they could answer the questions. And so you could maximize the time you spend with the doctor. That's what support looks like. For me, is that ability to clarify, ability to ask questions, and come prepared. Because that's, at the end of the day, how you could maximize and get the doctor's attention. So that's a part of it. Is sometimes we could come with you to medical appointments, which then helps, because the doctor then has to stop what they're doing and actually pay attention to it. Because I've seen that happen. Because then they're like, oh, there's a third party. Oh, there's somebody else now in the room. And so they're willing to spend time with you now more than what they feel like they're going to do. And they answer questions. and the person then the patient feels like, okay, I'm supported. Now I'm clear what's going to happen. Especially it happens when you just newly diagnosed, because half of stuff you worry, right? You don't hear, you don't hear it, what's happening, and half of stuff, I'm sure you just missed it.
Yeah.
Having a person there helps with that. Or let's say some things changes, and again, because we worry, if you feel anxious, right? We stop listening.
Yes.
Halfway
Yeah. You
through.
switch off, don't
Or
you?
sometimes doctor uses high words or medications or whatever the word they're using. Sometimes it just bypass you. You don't, and you cannot clarify. And so that's what happens with third person is for it to say, hey, can you just, what does it mean really? Right? I don't think this person understands. Or sometimes we use paraphrasing, right? So I heard you saying this, right? So we would paraphrase to kind of confirm what I've heard with the doctor.
Yes.
It creates clarity for the patient, and it also allows the doctor to say, oh, okay, so you misunderstand here, or you correct.
Yes. So for the US, because we do advocate in services as part of my role, but in general, advocations is around in all sorts of areas, but mainly for what we class as the vulnerable and people with no capacity or fluctuating capacity under Mental Health Acts. So generally, I'm a much older person because they struggle with medical terminology or because they may have some sort of mental health issue. But it sounds like that's not just what you do, you're advocating for. It's for anybody really who's got an illness and they need to obviously understand what's going on to sort of to bridge the gap between the medical professional and the insurance industry and the patients, and to make it seamless and smooth. So how does the US society accept that way of doing it? Is it something that they really want? Because we all get this impression that America, I've never been, if I'm honest, but from the outside, that it's all about transactions and money and business, and it's, being private healthcare. Are people fed up of that sort of way of dealing with private healthcare and they want something a bit more personable, like a human?
Do want personable, because anywhere, if you're a vulnerable person that receives Medicaid, because remember, in the United States, there's a private insurance through employer, and then there's a public insurance like Medicaid and Medicare. Medicaid is for individuals that financially, they meet the financial department. They have to be disabled, and then financially they have to be on a low income to qualify for Medicaid, right? Criteria. So what happens is with Medicaid is that you still want that personalized environment. You still want that personalized relationship.
Yeah.
You still want to be treated as a person, dignity first, right? You still want people still be treated with dignity and break it down what's happening with my health. Because at the end of the day, with insurance companies, so let me just go back. In America, private health insurance, right, is run by Wall Street, right? That's where they get their shareholders and backing. But the government still has, star ratings. It still has different measures to measure how well they're managing the people's health. And you could lose contract.
Right.
Because Medicaid, so state requires you don't have a straight Medicaid like in New York City right now. You have a managed Medicaid. So private companies receive money from the state and they manage people's health. So they're still being triaged and they still looked at how well they keep out of hospital, how well they continue to maintaining their adherence to medications, go to medical appointments and so forth. So those guys, so government still controls that part, and you could lose money and you could lose contracts. So that's one, right? So Medicare is a federal government. So we pay in every while we're working, and then at 65, you eligible to receive Medicare, which just covers hospitalization, medical appointments, and medications.
Okay.
And that covers the 80%. And 20% either you pay out of pocket, or you have you take insurance, or you use a managed care. So that's kind of like there are steps. But again, the same thing. The government still looks after you in a way to make sure that plans don't just delay treatment or they still has to manage your health. They still have to ensure that you follow through and they follow through. Now they could decide what treatments you could take. They may disagree with type of medication you should be on to treat the disease. They may feel like they could place certain restrictions on that, and then kind of the doctor has to follow through that process before you got the medication they already want you to be on. But because, let's say, their health insurance doesn't cover, so they have to go by what they want you to take in a way. So that's where discrepancy comes in. Who's treating whom, right? Who's making clinical decisions in this matter? So, but the person still wants to leave, because at the end of the day, it's about living. It's about quality of life, right?
Yes.
So I don't think in any system, American, UK, I think everyone wants the same thing. They want to be healthy, and then when they feel sick, there's somebody's going to be there to help them to understand what has happened, and then the type of treatment that they could receive so they can continue living. Because everybody wants to live. So I think, and then the question becomes, the secondary part: is it treatment that's going to improve my life, or what is it actually going to give? It's going to add years to my life. It's going to shorten my years of my life if I don't do anything, or if I do something, how is going to help me to continue living my life. And if there's any changes, then then I have to figure out how to make those changes, right? Because that's not because if in cancer, when you go through cancer, if you got to go radiation, there's a lot of changes happens all at once. Surgery first, they remove whatever they find, and then they go side of chemotherapy or radiation, depends on treatment. And then you could have side effects from that, and then whatever supports you have available, right? And all those steps, sometimes somebody needs to sit down with you and have a sit and actually walk you through. So I do believe that at the end of the day, we all want one thing. We want to continue living, and if there's a changes happens, somebody knows the answers. And now I have to make a